All right. Good evening. Thank you for joining us on another episode of JeffCo Health Matters, where we talk about the health matters that matter to our health. This evening, we are going to talk about COVID-19 updates, specifically for week 33, the data and whatnot that we're seeing for Jefferson County, as well as a lot of the new information that's come out surrounding Delta variant and vaccines and approvals and all that stuff. There's been a lot of information over the last week or two. So we'll kind of delve into that. I'm Brianne. I'm the Public Communications Officer for Jefferson County Health Department. And with me this evening is Jeana, who I'm sure we've all come to recognize now as well, our Public Health Preparedness Supervisor. So thank you for hanging out with us this evening, Jeana.
No problem.
Yeah. So we're going to just go ahead and jump into the weekly update. And I know it's not or socials quite yet. I just finished getting all the reports and stuff pulled together. I'll get that done right after today's live. But I can go ahead and tell you we are still in red status. The total cases in the last 7 days per 100,000 residents was at 235, which is well over that threshold, that 100 threshold. So that puts us in the red status. And our percent positivity is at 13.3%. So that's a little bit of a dip that we've seen from last week, as well as we know that our case count decreased slightly from week 32. However, I think Sarah, our epi, mentioned this last week in her analysis as well. We've been tending to get a couple, several late reports, like delayed reports of positive cases. So she put in there that she expects to see those. We had an additional 60 cases that came in for week 32 after our report went out on Wednesday last week. So just something to keep in mind when we look at those numbers. Our highest increase in cases was once again our 0 to 9-year-old age range, which is a bit concerning with school starting back up. And obviously at this time, they are too young to be vaccinated against COVID-19. There's some, let's see here. Speaking of vaccines, we went from 33.03% to 33.80% fully vaccinated in Jefferson County. So we're still going upward. But it's a very, very slow pace. So obviously we want to see that number increase so we can get the most prevention and protection within the community. And we also had 529 new COVID-19 cases that were reported in week 33. Of those 529 new cases, 86.39% were unvaccinated and 13.61 were vaccinated. So clearly showing the effectiveness there of that vaccine and really pushing just another piece of data to really push the fact that this vaccination is important. And it is one of the best prevention strategies that we have, particularly with Delta on the rise as well. And I think I put that we are all, oh yes, we're in the red status. And then this week we are also reporting 3 additional deaths. We had a male in their 70s, a male in their 80s, and a female in their 20s. That makes that the youngest death that we have reported in Jefferson County, the youngest COVID death that we've reported in Jefferson County since the beginning of the pandemic. I think that was the most for our data update. And like I said, I'll put that officially out on the website and social media after we finish up the live for this evening. Let's kind of chat a little bit about Pfizer becoming fully approved. Jeana, that's news. That was Monday.
Yeah, super exciting. The FDA has fully approved the Pfizer vaccine for anyone 16 and older. So it's still that age group that the original EUA was issued for. It now has a new name, and I know that that name is getting a lot of flack all over the place. I watched some information. Apparently there is a lot that goes into naming a vaccine, but the Pfizer FDA approved label will now be called, I'm going to say it wrong, Comirnaty. Comirnaty?
I wrote it down. So it's, yes, Comirnaty.
Comirnaty.
Comirnaty. Yes. And then, did you look at like how they came up with that name?
Yes.
It was interesting.
Yes. It's a combination of COVID, the
mRNA,
community, immunity.
Yeah, it was kind of cool.
Comirnaty.
I was like, there's no other way you would come up with that name.
No, and everybody's practicing saying it. So yes, Pfizer, fully FDA approved for 16 and older. They did revise that EUA issuance at the same time because they started at 16, they went down to 12. And we've also added now that second booster for those that are immunocompromised. So we have the FDA approval for 16 and older, and then we have an updated EUA that still includes those 12 to 15-year-olds, and it still includes the booster for anybody that's immunocompromised. So there's a little bit of confusion out there. It is the same formula. It's the same vaccine. They can be interchanged. You can use the one that says the Pfizer on the label or the Comirnaty on the label. It is the same formula. But that approval for 16 and older has gone through.
Yeah, and that's actually a really great, I'm glad you brought that up because that was one of the questions that someone had asked prior to, was if it was two different vaccines or if one was EUA and the other one was still or fully approved. So I'm glad you cleared that up. It's the same thing. It's just marketed under a fancy new name now because it's fully FDA approved. Yep. So you kind of also mentioned a little bit about the third doses for immunocompromised. So that was also something that came out, I think that was like the 13th? No.
Yeah, it's been a little bit.
It's been a little bit, but so those folks with compromised immune systems are now eligible to receive a third dose, which is different than the word booster. I want to make sure that we clarify that one. Right. And basically, if you are considered immunocompromised based on the criteria that they have put forth, you can get that third dose as long as it's been 28 days since your second dose, right?
Yes.
Okay. And that is for the mRNA vaccines, which is both Pfizer and Moderna.
Mm-hmm. Okay. Yeah. And they're looking at that immunocompromised, not because the vaccine isn't working properly, but those immunocompromised folks, it wasn't as effective when they received those first two doses. And that's why they're looking at that third dose, not because the efficacy has waned in them.
Really glad that you clarified that too, because my husband is actually immunocompromised. And so when that kind of came out, it was one of those conversations that we had. And it was the same topic of, well, does that mean that it doesn't work? And it's just that the medication that he's on for his autoimmune disorder significantly reduces his antibodies. And so that is a great point that you made. It's not that the vaccine isn't effective. It's just that they need that extra piece because whether it be their body from, an organ transplant or the medication that they're on for another condition, it just kind of slows down that immune response, if that makes sense. Yeah. So I'm really glad that you pointed that one out too. We are actually able to offer that in our office now, correct?
Yeah, so we have Moderna, but at this point we don't have Pfizer. That should be coming. But yeah, we are under the Missouri standing orders does allow for that additional dose for immunocompromised.
Yeah, and we have that. I know that this week it was like Tuesday and tomorrow we were scheduling in Hillsborough, and then today we were in High Ridge for the vaccine, correct?
I think so.
And then obviously our van is out and about in the community as well. So we have those opportunities. So we kind of talked about it a little bit with the difference between third doses and then booster shots. So booster shots are not the same thing as third doses, but sometimes they get interchanged, like quarantine and isolation. Folks think it's the same thing. So what is the talk about a booster shot, or what is that?
Yeah, and I am terrible about mixing those two up. I can isolation and quarantine, I can do all day, but yeah, they're looking at that second booster for all individuals going forward after that 8-month mark. But at this point, that is not been approved. Once it goes through, it'll go through the regulatory agencies at ACIP, and then we will wait for Missouri to update standing orders, and then we would be able to offer it. So at this point, we are not doing the additional booster for the general public, only for those immunocompromised.
Correct. Okay. Yeah. And that's something definitely to know. And if and when that changes, obviously we'll provide that information on our website and our social media. We'll make sure that the information gets out to the public. But at this time, like Jeana said, it's not gone through all of the processes yet. So it's just a conversation. It's not something that we're officially acting on at this point. Let's see. So we also wanted to chat a little bit about Delta, just to kind of clear up some of the confusion and stuff. We've had conversations before. We've put it in our updates. I think I was on KJEF this morning. We still only have one confirmed reported case of Delta within the county. However, we know that we probably have a lot of cases that are Delta variant because those tests are, you have a test that will tell you if you are positive or negative for COVID. And then that sample is sent off for genomic sequencing. And most tests don't go through that. Hardly really any go through that because it's a CDC state lab kind of recommendation or not recommendation, request.
Yeah.
So,
yeah, I know the biggest question we have is how do you test for it? And it's not the actual test.
Right.
All the tests in the community are still going to say the COVID, the SARS-CoV-2 positive, negative. If it was detected, not detected. Right. There is not a Delta test that we were running. So when folks tell you that they have Delta, that is not a test that they've ran based on how that is presented clinically. And we know the trends coming through. Is it Delta? Probably most likely. However, we don't have that definitive to say yes or no because we are not running that test. But those samples can go to the state lab for the genomic sequencing. And I believe they can only run about 100, 125 a week. It's a small number. And I think they're focusing on clusters and other hotspot areas. So that's why we aren't necessarily seeing the specific number in our county, but we do know that it's prevalent. There is the sewer shed studies that they're doing where they're looking at those water samples, and it has been identified there. So we know that it's in the area, and we watch those trends as it's kind of made its way across the state.
Mm-hmm. Yep. Let's see here. One of the other things that we wanted to chat about was we had kind of just talked about the fact that we do have J&J on site as well as our Mrna in Hillsborough, and it's on the van. You're still looking for vaccine, or if you're wanting to get vaccinated, we'll have that. And like Jeana said, we're working on getting Pfizer or
I can say it perfectly before we started.
I gotta look at my phonetic
recording
spelling up here. Comirnaty. Comirnaty. Yep. I still have to look at the phonetic spelling. I will get there someday. So we're working on getting that in the offices as well so that we can get that out to folks. One of the other things that I wanted to touch base on before we kind of get to some of the questions was I kind of mentioned it at the beginning with the number of vaccinated versus unvaccinated folks who had that, and clarifying what it means, like what a breakthrough case is and what that means. I think the word breakthrough sounds kind of scary. I was actually sitting on a webinar with a bunch of different other communications folks, and we were all kind of talking about the fact that that's like a scary word and it makes it seem like it's like really rare and incredibly scary. But in reality, it's just the number of cases that have been vaccinated that end up being infected. We see something similar to other diseases where we have vaccines, right? I mean, right. Flu vaccine, and people can sometimes still get the flu. Mm-hmm. So it's along the same type of lines as that. That doesn't mean that the vaccines aren't effective, right?
Correct. When we started our vaccine, I know that the big push was we felt like this was and it really was the next big step that we needed. It's the last step that we have to fight this virus, this disease. In those first few months, we saw very few breakthrough cases. Now, I know I just told you that I can't tell you every case in the county is Delta. However, as we see these new variants come through and they are a little bit more aggressive, we are seeing more of the breakthrough cases. However, it is still not the majority of the cases that we see. It's still a very small number. We know that no vaccine is 100% effective. We anticipated these breakthrough cases. The thought process behind the vaccine is that it's going to significantly reduce or almost eliminate these severe illnesses and death. You could still get sick. I've talked to some of the folks that have been vaccinated and that are sick again. They're having more mild symptoms. We can talk to a household with one person vaccinated and the rest aren't. Their symptoms are more mild than the rest of the household. So we know that it is still doing its job. And our hospitalization rate of vaccinated individuals is extremely low. And most of those folks that have been hospitalized and are having those severe illnesses typically are people that are immunocompromised. So we know that that vaccine wasn't as effective from the get-go in their body. And they also have a lot of other things going on that is making it complicated. So
Right.
they could be in the same situation, whether it was COVID or a different type of virus. But for the most part, the vaccine is acting as it should. So some folks are still going to have that breakthrough, but it should be much more mild than what it would have been.
Yeah, I had asked Sarah, our epi, prior to getting on here, if she just had any updated statistics that she had seen about vaccine effectiveness, specifically against the Delta variant, because that is a question that we've been getting a lot. And she pulled up the information, CDC's most recent MMWR said that Delta, the overall efficacy against infection is around 80%. This is the data for all three of the vaccines. So down a little bit, but still better than zero with no vaccine. And they still remained extremely effective against hospitalization, where the efficacy was still over 90%. That's just something to kind of take away too. We had a handful of questions that came in, and so I want to make sure that we have some time to get to those. Let me pull these up. So, and then I know that there's some that are in the comments, so we'll try to get to those as well. So somebody had asked before if there's a spike in the RSV cases locally, like nationally, explaining why there are people in the hospitals. So it's a great question. I reached out to our epi, Sarah, to kind of get that. So anecdotally, we have heard of an increased amount of cases of RSV. We know that back in July, DHSS had sent out a health, I think it was an advisory. It was one of the levels, advisory, kind of saying, hey, we're seeing an uptick in RSV cases and it's not even the season, just providing that general information. So we know anecdotally that we've seen that. However, in the state of Missouri, RSV is not a reportable condition. If it's only an outbreak situation that would be reportable. So we don't have that data offhand. So I wanted to make sure that we kind of addressed that one. Someone said, can you please explain why, if you are vaccinated and you can still get and spread COVID, why are you exempt from quarantine at school?
Yeah, so CDC put out, it's been a few months now, if you've been vaccinated or if you have had active illness in the past 90 days and you have a new exposure, you don't have to quarantine. They still recommend wear your mask, social distance, monitor yourself for those 14 days. And they're even saying now at day 3 or 5 from exposure to have another test administered to see what it looks like, because we know that there are breakthrough cases, but that risk is still extremely low of that breakthrough case. And so based on the data that they have, which is how I assume they make their decisions, based on that data and that low risk, that was a recommendation that they put out. And so we follow that. Delta could change the rules. That could change at any time, but at this point, that's still the recommendation.
It's an ever-evolving situation.
Yep.
We just keep up with the latest guidance.
Yes.
Someone said, how many of the 269 in total deceased were children in school? Why aren't you reporting on your colorful charts and graphs? It looks like there are 0 deaths under the age of 30. So we do have 269 total deceased, and I personally am thankful that I have not had to report the death of a child in this community, although it hurts my heart every week to put the deaths in our weekly update. Prior to this week, the lowest age range that we had was 30. However, like I just stated earlier, we have officially reported our first COVID death in their 20s. So that's just a personal thing too for me. It's heartbreaking to write this over and over and over each week. So really kind of pushing those prevention measures. So somebody asked how many Jefferson County residents died of drug overdose, drinking and driving accidents, etc. So I wanted to just quickly touch on this one. That data is different. We've kind of talked about that in a previous episode of JeffCo Health Matters. If you go back to the episode where we talked with our CD team, our 2 nurses and our epi, data for communicable disease or infectious disease is different than our data from chronic disease. Right now, we are in a pandemic, so we have a different reporting structure for our COVID-19 cases. Doesn't mean that we don't get data on drunk driving fatalities or drug overdoses. It's not on a daily reporting structure similar to what we're in right now with COVID. And I'm sure at some point, hopefully, we'll get to a point where we're not doing COVID every day as well. But the state of Missouri has some really great data profiles, and I can put the links in the comments after this video where you can find just the chronic disease data for the state broken down by county over the last couple of years and stuff. So you have more information that you're looking for.
Yeah, and just to add to that, we do have staff on at the agency that is their program. They were pulled to do COVID for quite some time, but around the beginning of the year, we were trying to get staff back to their core programs and their grant deliverables. So those are things that we monitor and we report on and we do programming with. So you should start seeing a lot more of that. We've been pushing some stuff in. I know that it probably gets lost between COVID, but that information has started to come back out again. So just kind of keep an eye out for it. But chronic disease is something that we still are very passionate about as well. COVID kind of overshadows sometimes.
For sure. So one of the questions was, when are you going to basically asking, I guess it's a financial question, the way that they worded it. So basically asking why, or if we are putting so much of money towards COVID, or why we're not doing other programs and things like that.
Oh.
So
Yeah.
you were just telling me earlier that at this time, our entire investigation staff is covered under that Missouri grant, correct?
Yes, all our investigation staff are covered under a grant. At this time, it is not pulling from our actual agency budget. We've just received another grant for adult immunization, and a lot of our COVID vaccine will be able to go under that. And we still have FEMA reimbursement. Some of our programs have 100% reimbursement, some have 75%. So we are still reaching out for every funding source that we can find to cover our COVID costs. We made a big effort at the beginning of the year to get back to regular programming and to not impact the budget as it was last year.
Right.
There's not a lot of choice in it. We have to continue to do what we do, but we are trying to find that balance. And we also know that the other programs we do are so important and vital to the community. We need to get those back out. So that's been the focus as well. But at this point, almost testing is still a little bit under budget, but we do other types of testing. That's not new to clinic, but investigation and now vaccine is covered under grants or reimbursements.
Right. So somebody asked about the Pfizer or Comirnaty. Yes, said that right? Comirnaty. Yes. So we're working on getting that in clinic and then out on the vans as well. Somebody had asked, and we kind of talked about the difference between Pfizer BioNTech and the Comirnaty. I'm going to say 100 different ways to Sunday here, but you kind of alluded to that too, that it is the same vaccine. It's just one's the new name that they have for that one being.
Yeah, I pulled up the FDA press release. I think it was usually on the FDA press release or the Pfizer release.
It was on the FDA one, I think, too.
Okay. Yeah. It clearly states it is interchangeable. It doesn't matter what that label says, so long as you are using it for the correct purpose.
Right. And I'll have that link in the daily or the weekly update as well, so folks can see that. Let's see. We had one on what are your thoughts on antibody testing for those who have had COVID and those who are vaccinated? Wouldn't more testing give more research into how our bodies react with it? Why does the CDC recommend against it? So Jeana and I were kind of talking about this and we were a little confused on the actual question, but I think what it was referring to is the fact that CDC does not recommend using antibody tests to identify active infection or to reduce your quarantine time. So if we didn't fully answer that question, either put it back in the comments or send us an email and I'd be happy to look into that further for you. Let's see. The only other thing we had here, let me look at the questions in the chat. I know we only have a couple more minutes here. Okay, what can you tell us about the COVID infusion treatment? Oh, KTVI. Okay, so I think that you are referring to the monoclonal antibody infusion. I'm trying to remember all of my words here. That's actually something that we just got the information fully sent out from state on. So we're going to have more information on that That's going to be through Mercy Jefferson though. So we definitely recommend reaching out to Mercy Jefferson for additional questions, or if you just have questions about antibody treatment in general, you can always hit up the CDC website. They've got some great info there. Let's see. Trying to see if there is anyone or any questions in here that we haven't gotten to. No one is dying. They can't test for Delta. I think we've hit most of the, not sure if you answered this one. Are you seeing trends in breakthrough cases based on which vaccine an individual received? That's a good question. I don't think we have the answer to that because we don't get the name or the type of vaccine that they received, correct?
So we are trying to get that internally for this county, but it's very, very manual. So it's taking that list and cross-referencing our state vaccine site, the Show Me Vax key.
Wow. Yeah.
So
that would take a while.
It's very manual. So we are trying to get that information for you. I know from hearing from folks that work in the ER and other health agencies, it seemed that Johnson & Johnson might have a little bit higher rate of breakthrough, but that is just, that's just what people are seeing, that they're noticing right there on the floor. So I don't have the data to back that up, but that's the only one that I've really heard that they saw a difference or that they noted that difference. But it is something that we are trying to figure out how to capture, but it's just a very manual process.
Right. We had somebody ask about the long-term effects of the vaccine. I mean, there's continued studies and trials, then they'll continue to look at all of that data. But as of right now, we know that they're effective. The most common side effects are listed on the website, and then in the packet, it's like arm pain and maybe chills, fever, things like that. So we're still working through those studies. Are we still in the red? Yes, we are. And you guys okay, so it looks like we've addressed most of the questions here. There's a couple in the chat that I can always go back in and follow back up with people and type in an answer. Thank you for joining us. This one kind of went a little bit longer. COVID updates, there's a lot that happened though, so we want to put that in there. Our next episode will be not next Wednesday, but the Wednesday after. So be sure to tune in for that. Again, if you have any questions or need any information, you can always hit up our website, jeffcohealth.org. Reach out to us on social media, or feel free to send us an email at communications@jeffcohealth.org. Until next time, have a good evening and stay safe.